Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Mmr Measles Mumps Rubella Vaccine Benefits, Risks and Side Effects. One of the side effects of the Mmr Measles Mumps Rubella vaccine is fever, occurring in up to 1 in 6 people in the US/R/N/R/N. Vaccination is still the best way to protect yourself and the people around you from measles, mumps, and rubella, and to maintain the rarity of these diseases in the US. There are some risks with getting the Mmr vaccine, and occasionally it can cause side effects, so it's important to know who should and should not get the Mmr vaccine. /r/n/r/nLWADann Tardif, Getty Imagesrnrn/r/n/r/n. The Mmr vaccine protects people from measles, mumps, and rubella. It is a 2-dose regimen that is typically recommended to start in early childhood. It is extremely effective at protecting against infection and severe illness. /r/n/r/n. The introduction and distribution of the Mmr vaccine in the United States changed the trajectory of these 3 diseases. Illnesses that were commonplace among baby boomers now occur very rarely. /r/n/r/n. Measles is a highly contagious disease that is characterized by /r/n/r/n. Although the symptoms of measles may seem mild, they can be fatal, especially in children. /r/n/r/n. One 2020 study on the reemergence of measles found that 350,000 cases of measles were reported worldwide in 2018, with 142,300 resulting in death. The majority of deaths occurred in adults with a weakened immune system or in children under 5 years old. /r/n/r/n. Mumps is a viral illness that causes the salivary glands to swell, creating the appearance of puffy cheeks. The swelling is often accompanied by /r/n/r/n. More severe complications of mumps include inflammation of the testicles, ovaries, pancreas, brain, or the tissues covering the spinal cord, as well as deafness, in rare cases. /r/n/r/n. Before the MMR vaccine was available, mumps was the leading cause of meningitis, an inflammation of the brain and spinal cord, and hearing loss in children, as well as hospitalization among military personnel. The introduction of the 2-dose MMR vaccine reduced cases of mumps by 99%, thus reducing negative outcomes. /r/n/r/n. Rubella is a disease that shows up as a rash on the face and spreads to the rest of the body over the course of 3 days, on average. Other symptoms of rubella include /r/n/r/n. However, in 25–50% of rubella cases, people don't have any symptoms at all. /r/n/r/n. Rubella can come with complications, like heart and bleeding problems. /r/n/r/n. Those most at risk are developing babies during pregnancy. If a pregnant woman who has not received the MMR vaccine contracts the illness, she is at a greater risk for miscarriage or stillbirth. A baby that does survive is at a higher risk of developing heart problems, loss of hearing or eyesight, intellectual disability, or liver or spleen damage. /r/n/r/n. If you do not have immunity against measles, mumps, and rubella, getting the vaccine within 72 hours of a measles exposure could provide some protection and help to reduce the severity of the illness. /r/n/r/n. This is only true for measles. Getting the MMR vaccine after being exposed to mumps or rubella does not have the same protective effects. /r/n/r/n. The MMR vaccine is recommended for all children, with the first dose occurring between 12 months and 15 months. The second dose should be administered between ages 4 and 6. /r/n/r/n. People who didn't receive the MMR vaccine in childhood can get it as an adult. 2 doses are still recommended and should be separated by at least 28 days. /r/n/r/n. It's still okay to get the MMR vaccine if you are sick with a common virus, because a healthy immune system can handle getting vaccines and fighting minor illnesses at the same time. Vaccines do not make symptoms of illness worse. /r/n/r/n According to the Centers for Disease Control and Prevention, CDC, there are certain people who should not get the MMR vaccine. These include people who, /r/n/r/n The MMR vaccine is extremely effective. It offers 97% protection against measles and rubella and 88% against mumps in people who have received 2 doses of the vaccine. /r/n/r/n One study looking at the effectiveness of the MMR vaccine in preventing hospitalizations found that no child who had received 2 doses of the vaccine was hospitalized for rubella or measles, and only one fully vaccinated child was hospitalized for mumps. /r/n/r/n In addition to being effective, the MMR vaccine is also safe. /r/n/r/n As with most vaccines or medications, there are risks and side effects that can occur. According to the CDC, the most common side effects are /r/n/r/n A fever from the MMR vaccine occurs most commonly between day 7 and day 12 after receiving the injection and typically lasts 1 or 2 days. A MMR fever is not contagious. /r/n/r/n More serious side effects can occur, such as seizures, often associated with fever, or temporary low platelet count that can cause unusual bleeding or bruising. Talk to your healthcare provider if you have concerns. /r/n/r/n If you have a severe allergic reaction to the MMR vaccine, call 911 and go to the nearest hospital. /r/n/r/n Measles, mumps, and rubella are serious illnesses that can lead to lifelong health problems and, in some cases, even death. Vaccination against MMR is the best strategy to avoid the long-term consequences of these diseases. The MMR vaccine has proven to be safe and effective. /r/n/r/n MMR vaccines are recommended in childhood with a 2-dose series, but adults who have not received theirs are eligible and encouraged to get vaccinated. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.